guys, welcome to my channel, NPBossMom, where I talk about being an NP, an entrepreneur, and a mom, and a wife, and everything in between. Today, I'm talking to you about monoclonal antibodies. Monoclonal antibodies. It's a newer treatment coming out for COVID. It is not a substitute for the vaccine. It's not a treatment against COVID. It's just to help you survive if you get it so you can breathe. So we're seeing more hospitals have the treatment. However, the government has just restricted supply. So as y'all know, I'm a clinic owner. I was planning on getting it in my clinic so I could inject it into people who needed it. It is for people who have already contacted COVID and people who have immune problems and may contact COVID. So like I said, it's pretty much to save your life. It has proven to work in some people. It is an emergency use authorization by the FDA. It is not being completely studied. So it is still in the trial phases of being saying that it is a true treatment, but it has helped. A lot of hospitals have used thousands of doses right now, and it has helped a lot of people. So it's basically all we have besides the vaccine. And again, it is not a substitute for the vaccine, the COVID-19 vaccine. And I don't know if I mentioned that before. This is talking about COVID-19 monoclonal antibodies and how they work. So I'm not giving you any clause here. I'm doing a legal clause. I'm not giving you any medical advice in this video. It is just for entertainment purposes. I wouldn't even say entertainment purposes, for informational purposes, to get the word out there. There is a treatment out there if you are having severe COVID symptoms or any COVID symptoms, so it will not progress to severe COVID symptoms. If you have tested positive for COVID and you're having symptoms, you can get this treatment. So again, what it is your body makes antibodies to fight off diseases and infections. And so what we're doing is injecting an antibody that was made in a clinic, made in a lab, to give you more antibodies to fight off this infection, because when your immune system is low, it's having a hard time to fight. So what happens is these antibodies clip onto your cells to fight off. So they're like spiky. And maybe I'll put a picture up in here to fight off the virus. So that is a treatment that we're looking into. Not even looking into, it's working, guys. It's keeping people alive. So I really hope the government releases more doses out to the small clinics. And that's one thing I'm having a problem with, is being a small clinic and just not being able to get the supply, like the federal supplies. I'm having to pay for everything out of pocket, and it's slow going on my payments so I can get more equipment. So it's like a lag time. I want to take advantage so I can help my patients more, provide the same things as the bigger clinics and bigger hospitals in our community. Because right now you go to the hospital, unless you have somebody you know. I have a colleague that just got it, but she had other colleagues that had said, hey, come in and get this treatment, where, you know, the hospitals have waits. And I don't know if you actually have to be in the hospital to get, like, admitted to actually get this treatment. Where in a clinic like mine, you wouldn't have to be admitted into the clinic or the hospital. You just roll up, say, you know, we test you, you test positive, you're having symptoms, we give you the antibodies. So, and just recently in my community, we've had a couple of deaths from COVID, and I don't know if I could have given that, you know, antibody and maybe saved life, because they were like, we were literally just talking to them, and 3 weeks later they had passed away. So there's some life-saving technologies out there But again, I can't say this enough, that we have been advised that it is not a substitute for the virus. I mean, for the vaccine. The vaccine costs about $20 to make or administer, where this infusion costs like $1,500. So needless to say, the government is not gonna keep paying for everybody to get it. You really literally have to be on your deathbed. Some of the Western states got it before they closed it down, and they were able to get it into clinics, and they could drive up, or hospitals, they could drive up and just, hey, if you want it, get it. It was a major supply of it. And now the supply is decreased, and the government has taken control over the doses. So maybe if y'all request that smaller clinics can get more access to these things, life-saving measures, maybe we can get them. Again, New Heart Medical, that's my clinic. I haven't really been promoting it, and I should have. In Conyers, Georgia, New Heart Medical Center in Conyers, Georgia. We are providing care for the community. We will try to make healthcare accessible and affordable, on top of just, taking care of you. So we see everybody. We see newborns all the way up to no age limit. So like I said, New Heart Medical Center. We're seeing everybody. We take a lot of insurances. All these insurance that we really see a lot, and we do not take, is Blue Cross Blue Shield, Anthem. As y'all see, I got my aligners in, guys. I've been talking a lot about these aligners. It helps me. It kind of makes me slur my words. So forgive me if I'm not speaking clearly. But I just want to get the word out today about monoclonal antibodies. Again, this is for informational purposes, not for you to take my medical advice. I am not giving out any medical advice on YouTube or any platform. I just like to give information that I find out, and I come back and give it to you. So thank you for watching me. Have a great day, and God bless.